Good day! In this video, I will present a case that focuses on aminoglycoside, its adverse reactions, and the nursing actions needed to identify if the patient who is taking aminoglycoside is experiencing nephrotoxicity. Without further ado, let's proceed to the case. Mr. Jones has been admitted to your unit with a serious gram-negative infection. The physician has prescribed an aminoglycoside. As his nurse, you would be responsible for monitoring him for any adverse reactions, including nephrotoxicity. Discuss the nursing actions needed that will enable you to identify nephrotoxicity in this patient. So here are the case facts. The first is Mr. Jones has been admitted to your unit with a serious gram-negative infection. Next is the physician prescribed an aminoglycoside. The third one is you would be responsible for monitoring him for any adverse reaction including the nephrotoxicity, and then discuss the nursing actions needed that will enable you to identify the nephrotoxicity in this patient. So the first case fact is that Mr. Jones has a serious gram-negative infection. This could be pneumonia or the inflammation of the lung tissue, peritonitis or the swollen peritoneum, urinary tract infections, bloodstream infections, wound or surgical infections, meningitis or the inflammation of meninges, tuberculosis or the communicable disease that affects the lungs. The second case fact is that the physician has prescribed Mr. Jones a drug which is aminoglycoside. So what is the action of this drug? Well, it irreversibly inhibits protein synthesis. This protein is needed for the bacteria to grow and become numerous that causes infection. Aminoglycoside includes kanamycin, amikacin, neomycin, gentamicin, streptomycin, and tombramycin. The next case fact is the monitoring of the adverse reaction of the drug aminoglycoside. The first is ototoxicity. The manifestations are hearing loss and loss of balance. According to the nurse practitioner that I interviewed, hearing loss might be neglected to older adult patients since they usually have hearing loss as they age, but we still consider this as a major sign. Patients may verbalize that he feels like there's a buildup of earwax in his ear even though there is none when assessed. Loss of balance are late signs of ototoxicity. The next adverse effect is the neurotoxicity, which affects our nerves. The manifestations are the following: tingling or the feeling of darting around the mouth, hands, or other parts of the body; numbness, the feeling of thickness; muscle weakness; tremors or the involuntary shaking of hands or other parts of the body. For the third case fact, we will identify the adverse reaction of aminoglycoside, including the nephrotoxicity. The last adverse reaction is nephrotoxicity that affects our kidney. The manifestations include muddy brown urine. The muddy brown urine looks like this. Proteinuria, which is the urine is foamy and bubbly even after 15 minutes of urination. According to the physician that I interviewed, the increase of urea nitrogen and creatinine level, which are the toxins in the body, are initial signs and can only be detected through blood tests. The last case fact is to identify the nursing actions needed in order to identify the nephrotoxicity. The independent nursing actions are the following. The nurse encourages the patient to increase fluid intake. The nurse measures and records the fluid intake and output of the patient. The nurse monitors the appearance and volume of the urine. Collaborative nursing action includes another health practitioner, which is the medical technologist, who will do blood tests to identify the changes or increase in creatinine level or blood urea nitrogen. And also, dependent nursing actions also include the attending physician. The nurse will report all the necessary changes or signs and symptoms of nephrotoxicity that may be subjected to an order to stop administering the medication or taper dose of aminoglycoside.